What I'm here to talk to you about this evening is the nutraMetrix division of Market America, one of our university majors. And what we're going to talk about during this session is, first of all, what is nutraMetrix, and why should everyone look to recruit nutraMetrix consultants or add nutraMetrix consultants into their organization? So let's talk about what nutraMetrix is. It's a division of Market America that provides a wide variety of wellness products and services to health professionals. What types of products and services do we offer? Well, how many of you love our health and nutrition product line? How many of you have had a positive benefit by taking one or more of our health and nutrition products? Let me hear from you. How many of you have customers that have benefited from our health and nutrition products? Well, doesn't it just make sense that health professionals should have access to those same type of products? And in the nutraMetrix division, we took all of the health and nutrition products that you have and all of our wonderful cosmeceuticals and all of our baby care products, and we rebranded many of them in the nutraMetrix line. So let's talk about what this means, right? Because we know in not only our country, but in the world, most people just don't live the type of healthy lifestyle they should, right? They don't eat right, they don't get enough sleep, they don't get enough exercise, and because of that, we have chronic diseases that are associated with lifestyle. And many times, those patients that have chronic diseases or health challenges, they go to their health professional, and what happens? They're treated for sickness, but they're not really taught how to promote wellness. Wouldn't you agree? I mean, in most places, when we talk about preventative health care or wellness care, it's talking about early detection. It's not really talking about prevention, and we want to change that. So let's talk about some of the things that health professionals are facing. Well, in addition to the chronic lifestyle choices that are leading to diseases that the health professionals are seeing in their patients, the economy of healthcare is changing every year. We hear about it in the news. We hear about the need for healthcare reform. We hear about the fact that reimbursements are shrinking. We hear about the fact that health professionals are struggling to stay in business. And I tell you what, I want my health professional to be able to stay in business, don't you? I want to have somebody that I can go to when I don't feel well. On the rare occasion that I get sick or don't feel well, I want to have good doctors to be able to go to. And if we don't do something, right, the good doctors aren't going to be able to stay in business. So at the same time that health professionals are looking to overcome the challenging economic times, patients are looking for wellness options. We know that because many of the patients are people that are complaining to us that they don't feel well, right? So patients are going to their doctors, they're asking questions like, how do I lose weight? What can I do to prevent future problems? How do I stay on track? And traditional medical schools don't often teach them these types of options. They don't teach them about wellness options. They teach them how to diagnose, prescribe, and they teach them about surgical interventions, those types of things. So with nutraMetrix, we teach them how to implement great, high-quality products that deliver results into their practice. And how do we do that? Well, we introduce isotonics to them. We introduce TLS, weight loss solution to them. We have all the custom cocktail products available for them. We have marketing materials. We have trainings. Do you know that health professionals have to get a certain number of continuing education credits each year in order to maintain their license? Right? No matter what type of health professional you're talking about, they have to receive either CMEs, which are continuing medical education credits, or CEUs, right? So we offer through our nutraMetrix Educational Institute the ability for them to earn credits to learn how to implement wellness in their practice, right? In addition to that, we offer to them a nutraMetrix consultant. Well, what is that? That's you. nutraMetrix consultants are nothing more than unfranchised owners who attended a specific training to learn how to work with health professionals and their staff, right? Then we give the health professionals a special portal that's focused on their patients, and we provide to them the same types of market-driven products that we already know and love. How many of you love the Daily Essential packets, right? The Isotonics Daily Essential packets. Isn't that a great fit for in a health professional's practice? So let's talk about, as a nutraMetrix consultant, what an NC would actually do. You see, we have a 3-day NC training where we teach unfranchised owners how to go out and, first of all, get an appointment with a health professional. Then once they have the appointment with a health professional, provide in a 15-minute appointment an interview to find out if that practice is looking for wellness options. It's not about going out and presenting things to them that they don't need. It's about finding out what they need and then sharing with them the solutions that we have. So we teach them how to do an overview of the products in the follow-up appointment, how to create a business proposal for the practice so they can generate revenue for the practice. We train their staff, and we do the whole thing to make it easy for the health professional to implement our products into the practice. We provide the unfranchised owners, the NCs, and the health professionals with incredible tools so that the health professional can introduce their patients to our product line very easily without feeling like a salesperson. So we have patient posters, we have exam room posters, we have brochures, and then we teach the health professional how to do something very simple to introduce the product line to their patients. It starts out with a poster that looks something like this that says, how do you feel about your health today? How many of you have ever gone to a doctor's office and they asked you how you felt, right? They do that. Why are you here today? What did you want to talk about today? And on the scale of -5 to +5, where do you fall? With 0 being an absence of health challenges. So then you're introducing the health professionals, finding out why is that patient there and what is their goal in wellness. Then we have a whole series of brochures and PowerPoints and education materials that the health professional can share with their patients to say, okay, you feel like this today. Maybe you're a -3. Maybe you have no energy, you have joint pain, you're not sleeping right? And you're telling me that you want to wake up in the morning full of energy with no pain. Well, in order to get you from there to here, here's what we're going to do. And that's when they introduce the product line to them. Very easy. So patients go into the health professional's office. Let me show you how this can translate into BV for your organization. And they might even just ask them something simple like, doctor, do you recommend I take a multivitamin? The doctor is going to say, well, yes, I do. And in fact, I've done my research, and I really love the isotonic line. And I'm going to recommend this packet to you, which not only has a multivitamin in it, but it has a B complex, it has a calcium, it has a great antioxidant formula in it. So let's say that the practice has 5,000 patients. They're just going to focus on a simple implementation and introduce the daily essentials packets in the practice, okay? If they have a goal of 5,000 patients with 10% participating, that means over the course of maybe their first year, our goal is going to be to get 500 of their patients buying this product. Now imagine this. Imagine if you had one unfranchised owner in your business that had 500 customers buying this every month. What would that do for BV in your organization? And then imagine if you had one of those health professionals in each leg of your business. Would you like that? I mean, the daily essentials packets have 34 BV times 500 people buying it every month. How many of you would like 17,000 BV a month coming up through your organization because of one type of health professional, right? So the way that it works is we show the health professional how to implement a program through a retail model. We'll talk about this at the breakout tonight, where they can generate about $150,000 in retailing just this one product in their practice. But that $150,000 that the health professional is retailing is flowing up through your organization in BV. That's incredible, right? So if we use this example, let's say that your goal is to get to 5,000 and 5,000 BV a week. 5,000 BV on the left, 5,000 BV on the right. In order to do that with daily essentials packets, you need to move about 150 boxes per week on each side. So now the question becomes, how many unfranchised owners and health professionals do you need on your team doing that, selling that? Well, it could be 2 big health professional practices, one on the left and one on the right, that have 500 patients each. But maybe it's 4 health professionals on the left, 4 health professionals on the right. Maybe it's 8 smaller practitioners on the left, smaller practitioners on the right. You can start where your comfort level is. You don't have to go out and close big practices. You can start with small practitioners that you already know. So here's my recommendation to you. Create a team of NCs. Focus on having 4 NCs on the left side of your organization and 4 NCs on the right side of your organization, because let me ask you a question. How many of you know a health professional? How many of you are a patient of a doctor? How many of you go to an eye doctor, get massages, go to a chiropractor? Everybody you know knows health professionals. And the more people that you have trained in your organization that know how to work with health professionals, the more health professional referrals are going to come into your organization, right? So you may not want to major in nutraMetrix, but I guarantee you, you're going to have people in your organization that show up that have health professional contacts. and you might want to get trained to learn how to support them. So if nutraMetrix isn't a great fit for you as a personal unfranchised owner major, you still want to recruit them for your business because everyone can benefit from the power of nutraMetrix. So this time I want to bring out Dr. Roger Spahr. Dr. Roger Spahr is our medical director for nutraMetrix. He has been an unfranchised owner since 1999, one of the pioneers of nutraMetrix, board certified in family medicine and functional medicine. And please welcome Dr. Spahr to the stage. Dr. Spahr, can you tell them a little bit about your experience with nutraMetrix?
Well, I had both the pleasure and the honor of really introducing nutraMetrix to us about 10 years ago. Now, you must admit that in 10 years, it's grown quite a bit. And with that, with growth comes change, doesn't it? And we see change all the time in our medical practice as physicians. Science changes, correct? And many things change about how we see our patients and even governmental regulations, including things such as wellness initiatives in our practices that we need to make sure that we are taking care of our patients and prove that we're taking care of the patients. So nutraMetrix is continuing to change and move with these changes in everything else: science, nutrition, data, and even regulatory processes. So with that, I encourage you to go ahead and come to some of our HP trainings, our health professional trainings, and the NC trainings. If you were trained even recently, you'll find that we are doing things many ways differently now than before. We're adding things all the time. So that's what I want to say at this point in time. So at this time, I do want to bring out two individuals. One is Dr. David Redding. That is Carl Eklund. Dr. David Redding is a chiropractic physician who studied at College of Chiropractic. He's been the CEO of his own company for the past 13 years. He has retailed this last year, since he first came into practice in 2013. In 2014, he retailed over $50,000 in products. And he's also a multiple challenge winner. Also, Mr. Carl Eklund is here as well, Mr. Shopping Annuity. So, Dr. Redding, please kind of share with us, what was it about the products that allowed you to retail $50,000 and more in 1 year?
It was really quite easy because once I started using them with my patients, the results were there. And it's not necessarily selling the products, it's more sharing because of the testimonials I get. In the first 3 months using nutraMetrix, I got more results and more testimonials in 3 months than 21 years combined as a chiropractor with every other health professional line that I've carried before.
Wow, that's good.
Results are phenomenal.
And then how did that impact the financial gain of your practice?
Well, it's been huge. The average collection of a patient went from $42 to $54 just in the first 3 months. And
wow,
it's really taken the edge off, and it's allowed my wife and I to see this business, Market America, supplanting the chiropractic income and getting out of the 45-year plan and reducing that to 2 to 3 years.
So you've also embraced that. Yeah. You've also embraced the shopping annuity as well.
Absolutely. With Carl being my mentor, I've definitely embraced the shopping annuity concept because he taught that right from the get-go. And actually, it was the internet aspect. It was the shop.com site that I saw that really intrigued me. So I was all about the shopping side actually before the product. So I encourage other health professionals and or other nutraMetrix consultants to, don't hide anything. You might want to show the whole plan and don't hide the shopping site because that has been a major factor in my business.
Awesome. Thank you very much.
Carl, in the NC training, we teach that when you find a health professional, whether they show up in your organization organically by a referral through a warm market, or whether you go out and try to set an appointment with a health professional, one of the things you do is you focus on their practice first, and you get their product, you get the moving products, which you did. And his $50,000 plus in his first year is fantastic. But I want you to tell them, first of all, where you found Dr. Redding. Like, where did this guy come from, right?
We're still trying to figure that out. But, No, I was actually introduced to David Redding through a fantastic unfranchised owner. Her name is Donna Hoy out of Rochester, New York. And she actually found Dave through a social media Facebook post that she put out about her internet business. And it was interesting because she called me and she didn't feel confident at that time. She was rather a new distributor too. And she didn't feel confident showing a health professional the business plan. So she asked if I would come over to his home and show him the business plan. Now, I kind of thought it was going to be a nutraMetrix appointment. But when I got there, I sat for a minute and was talking with Dave and his wife, Chris. And Dave said he was actually looking, he was interested in the internet aspect of the business more than he didn't know about our nutraceuticals yet.
Yeah.
And while he fell in love with them after, I just did our business plan the way I do. I did the portal tour first and I showed him the business plan. He had a bunch of his friends there and he identified his first 2 partners that night while we showed the plan. And since then, he's personally sponsored, I think, 23 individuals, many health professionals. We just brought 5 more in Puerto Rico on, and we're expanding down there now. And I don't know where this is going to end. We've had such a great time building this business together. We've become great friends, and he's just a pleasure to work with. He embraced the shopping annuity right from the beginning, not just nutraMetrix. He did the whole business, and the shopping annuity is the business. His office has switched over all their spending, and he is just blowing up. He's got people getting paid in his organization, and it's just been amazing.
That's fantastic, fantastic. Now, Dr. Redding, so you shared that you've used other product lines in the past without the same result that you've gotten with nutraMetrix. How does that help you keep patients on products, right? Because one of the things that we find is sometimes health professionals, they get the patients to try the product one time, but the important thing is to get them to stay on products. How do you get your patients to stay on the products?
It's easy. It's results. Before, if a patient bought a product from another line, if they came back and bought another one, I'd be elated. Now, the stuff just sells itself. People walking off the streets, not even patients, buying product and buying OPC3. I can't keep it on my shelves, literally.
So it's brought new referrals to your practice as well.
Absolutely.
Do you see how nutraMetrix can help bring new patients to the practice, bring new revenue to the practice, and then eventually bring on a new full-blooded shop.com in their DNA shopping annuity, embracer, right? It's not just about our products, it's about the entire picture, even though you start with one particular division. Thank you very much.
Thank you. I also want to thank Dr. Deidre Mason, who's been a great mentor to myself. It's been awesome.
Thank you. Thank you so much. So, the reason why I wanted to share this particular testimonial with you is because sometimes I think people get nervous about the fact that they have to go out and call on health professionals and go out and visit doctors' offices, and they're not sure if they want to do that. And what I wanted to share with you is the fact that, listen, look at how that happened. There was an unfranchised owner who posted something on Facebook, and he responded to it, and he was interested in the internet side of things and happened to be a doctor. Right? So one of the things I want to share with you is you have no idea where health professionals are going to show up in your bean jar. But health professionals are going to show up in your bean jar. So think about this. Health professionals are people just like everyone else. They have health challenges just like we do. They have financial concerns just like we do. They have goals for their family and dreams for their family just like we do. And because of that, they're going to show up in your business somewhere. So you want to make sure that you and your team are prepared on how to handle them, because when they do decide that they want to implement the program in their practice, there's unique challenges. They have staff to think about. They have to figure out how to retail the product to their patient. They have a built-in customer base, and you want to get it set up properly, because if you don't set it up properly, you're not going to get access to those 500 customers buying every month and that 17,000 BV that can be generated through your organization. So let's think about who should attend an NC training. My suggestion is everyone. Why? Because you never know when the health professionals are going to show up. And attending the course is going to teach you business building skills on how to retail. Because how can we expect you to teach a health professional how to retail products to their patients if we don't teach you something about retailing, right? So think about this. TLS coaches, how many of you have ever had a positive result with TLS with one of your clients and their health professionals wanted to know what they're doing? Right? So TLS is a natural fit that leads to nutraMetrix. How about Motives Beauty Advisors? Have you ever had a woman sitting in your chair whose husband was a health professional? Right? You might be looking at someone as a Motives consultant and find out they're married to a doctor. MA Web Centers people, MA Capital Resources people. Think about this. Everybody could lead to health professionals, so you want to get trained. We have 3-day trainings called the nutraMetrix Consultant Trainings. It's $395. The dates are there for you. You can learn more about them up at the booth. Now, we're launching something new this year that we're really excited about, and we'll talk about it more at the breakout tonight. But for those people that attend an NC training, when they purchase their ticket, There's actually an online training that they can start right away. This will start March 1st, where they can actually get their NC status up to 6 months before the actual event happens. That way you don't have to wait until the next NC training comes up in your area. Guys, nutraMetrix is poised for explosive growth, and we want you to be able to take advantage of that growth. So find NCs for each leg of your business. We'll even help close them for you. We do webinars every Thursday night where we can introduce your potential partners to the nutraMetrix opportunity. All you have to do is email webinars@nutraMetrix.com to get the list of upcoming webinar links. Then also, we want to see you in your local areas. There's new NMTSS events in the NMTSS system. Request with your local coordinator that nutraMetrix events come to your area, and we look forward to seeing you at our breakout tonight. Thank you very much. We'll see you later.